Hello, my name is Dustin Miller. I'm the City of Pampa Community Services Director. I'm also the Public Information Officer. What we want to do tonight is get in front of you and introduce you to our COVID task force. This is a group of people that represent all kind of entities within our community. This group of people have met beginning in early March when this COVID situation really started to hit our not just our town but our country. So what we're going to do is introduce them to you individually, and then they're each individually going to introduce and talk about what they represent. So we're going to start with City of Pampa Mayor Brad Pingle. We have the City of Pampa City Manager Shane Stokes. We have Pampa ISD Superintendent Dr. Tanya Larkin. We have Gray County Local Health Authority Dr. Kevin Seek. We have our Gray County Judge, Judge Chris Porter. We have our Pampa Regional Medical Center Chief Executive Officer Edwin Leon, and City of Pampa and Gray County Emergency Management Coordinator Wes Schaefer. Once again, these guys are going to talk to you and kind of, we feel like there's some important information that we need to get out to the community and kind of just basically where each of us stand and what's going on within our community. So we're going to start tonight with our local health authority, Dr. Kevin Seek.
Hello, everybody. Just right now our hospital is seeing the largest surge of patients we've ever seen with COVID. Um, from March all the way till now, we really had not seen the influx of extremely ill patients. We didn't have ventilated patients. We didn't have just extremely ill COVID patients until the last 2 or 3 weeks. Our numbers have just surged. We are looking at, we've brought in extra help from the state. The state has sent us 20 nurses, 6 respiratory therapists, and actually 1 physician to help with the number of cases, because in any hospital, the staffing determines how many beds you have available for everything. We've brought in a telemedicine intensivist, pulmonary critical care doctors who are available by telemedicine for our ICU patients, and our respiratorily ill patients are out on the floor. The hospital is doing a great job. The staff is doing a great job. Nurses are working endless hours. Doctors are working endless hours. And it goes all the way down to our cleaning staff, our radiology staff. Everybody's just putting in extreme hours because there's really no break. We even have clerical people going up and taking phone calls, getting supplies to rooms, because when the nurses and the staff are in PPE, they're not able to just run down the hall and grab something. But our ER the other day saw a little over 50 patients in one day. And right now in our hospital, we have 8 ventilated patients that are COVID positive. We have another close to 20 patients that are COVID positive. They're on the floor that are kind of tenuous. And like I said, we've never seen numbers like this. And one of the big dilemmas is, the whole area is getting hit with this, the whole, the state, the nation. We've had to transfer patients to Denver, Colorado. We've had to transfer patients to Austin. My director of nursing spent hours on the phone the other day trying to get a patient transferred, and it called 13 different hospitals that are major hospitals. These are not small hospitals, and they're all could not accept the patient because of the lack of ICU beds, ventilators, those type of things. So we're doing a lot of things here to take care of our community. Still, if you're sick, if you're ill, come to the hospital. Don't stay home. We need you there to take care of you. But again, it's very serious. I mean, we're looking at right now on the report I received this morning, Northwest is considered high volume, which means they could go on divert at any moment. BSA is on divert. They're not accepting new patients. Pampa is considered what is called auto open, which means we have a person that is in charge of receiving phone calls for transfers from all over the area. and determines whether or not we can accept those patients or not if we have the availability of staff and of resources, which we've received patients from Denver City, we've received patients from Levelland, received patients from, well, all over the Panhandle. But like I said, as far as Lubbock, because Lubbock at this time, Covenant Hospital in Lubbock is on diversion. They're not accepting new patients as of this morning. Now that may have changed, but, and then University Medical Center is listed as caution, which means you don't know if they have beds or not. So we are in a serious situation in this area, in our community. It's real, it's live, it's happening. Wait times in emergency rooms are extremely high. So when you do come to the emergency room, you know, we have to triage people, and the sicker get seen first. And that's just the way things are. When ambulances come in and we have people in respiratory distress, they bump people back. So there are going to be longer wait times than anyone ever expected. But that's just kind of where we're at. Again, you know, our hospital, we're listed as a 31% COVID rate in our hospital. But when you look at the true numbers, 75% of the patients we have in the hospital are COVID positive. So we just need to do everything we can to support the hospital, you know, do everything we can to flatten this curve. I know masking is very controversial. I know a lot of people don't want to do it, don't feel they need to do it. I've spoke to many patients who've come in my clinic and they can't believe how many COVID positives we have in our hospital, and they don't believe it's in our community, but it is. It's real and it's here, and we need to do the things we know that can help, you know, the masking, washing your hands, social distancing. You know, large group events are not beneficial for this at all. And we're putting a huge strain on our hospital, and that in turn puts a real risk to our community as far as the care that can be distributed. So that's where we're at right now. And like I said, the hospital is doing a phenomenal job. I'm very proud of our nurses. Our core nurses are phenomenal and working tirelessly. People are pitching in, showing up, just helping. I mean, simple things as carrying out trash. We don't have enough staff to do that, you know, because everybody is just so focused on patient care that other things are building up. But it's what it is, but we just need the community's help to slow this down.
Thank you, Dr. Sieg. Does anybody have any other questions or anything we may have missed with Dr. Sieg, or before we want to move on to Dr. Tanya Larkin?
And I guess before we move on, I will say too, not to make this bleak or more grim, but as I shared with the committee earlier today, you know, the sad part about this is the reality of this is I've signed more death certificates due to COVID than I ever have since March. So I've signed way more this week than I've ever thought I would have to sign in my life. So again, that's just one more emphasis on how real this really is.
Dr. Sieg, just to make sure that it's clear on this, it's not that we don't have available space in the hospital, it's the fact that we just don't have people to man that space. So, you know, I've heard kind of through the community, the hospital has a whole lot of rooms in it, and that none of them that a lot of them aren't occupied. But the problem is not room space. The problem is actual ventilation use or ventilator usage, and the fact that we only have 8, and that those are taken up and have been for a while. And that also the staffing, even with the help from the state that's come in, we're still not able to completely occupy the entire facility. We're only able to occupy what we can staff for, correct?
Right, exactly. Because I'd say 99% of the time nationwide, when a hospital goes on diversion, it's because of nursing care. They don't have the level of nursing care. And the problem is with the number of hospitals that are seeing surges, everybody is requesting help from the state. We need more nurses. We need more nurses. We're very blessed that we got 20 from the state but Amarillo, I believe, has 50 plus from the state or more. So it's never a matter of, it's not the room, it's having the bodies to take care of those patients. And, we go from having, oh, we got an ICU bed open to, we may have 3 or 4 hospitals calling us going, if you get a bed, I have a patient. So then you have 4 patients backed up, 5 patients backed up, 6 patients backed up that are begging from a room from the community. And then you have 3 in the emergency room. All of a sudden those beds are full and the staff again is at a critical limit. So yeah, it's staffing. I mean, if we could have, again, but if we have 100 nurses, I mean, we have availability of 15 to 20 vents. We have the ventilators, but then it's the staff to manage those vents. And it's actually things you don't think about on a routine basis, the outlets you need for those, the suction you need for those, other resources that a hospital is not equipped to have. A hospital of our size is not equipped to have 20 or 30 ICU beds. So it stretches everything at a limit. And still, we're the 3rd largest hospital in the Panhandle. And when Amarillo is full, and we're getting we've gotten transfers from the VA in Amarillo. And so it's just a stretch on resources that are not there. I mean, yeah, I can go up and tell you there's several beds that are empty in different areas of the hospital, but we can't put somebody in there and not have enough staff to go take care of them.
Dr. Seek, you mentioned earlier also, yesterday in our report to the public, we reported over 400 cases at the prison. You mentioned earlier that the hospital cannot even absorb 1% of those patients if they were to need hospitalization. Is that correct?
Yes. I mean, anytime you have 400 patients that are 400 people in a closed environment that are positive, if we start seeing a decline in their conditions, I mean, obviously that's a huge strain on our system. And no, I mean, we're not able to do that. Now, we've been in conversation with TDCJ and then letting them know that. And so a lot of their facility inmates may be shipped downstate to prison facility, medical facilities. So we've already discussed that with them and trying to have a contingency plan on that.
All right. Thank you, Dr. Seek. I guess if we need to come back to you at any point, we will. Next, we're going to go to Pampa ISD Superintendent, Dr. Tanya Larkin. She's going to give us an update for the school system.
Hi, everyone. Thank you for the opportunity to share some information with you. And I just want to echo what Dr. Seek said. Our people are amazing. Our community is wonderful. We know you're praying for us and supporting us. And we're thankful that you're listening to this to get the information so we can all share in this responsibility as a community. I did want to share just some information with you about the district. As you know, there are a few schools around us that have already had to make the difficult decision to close their schools for a few days before Thanksgiving. And it's important that people understand that they're doing that not because of a high volume of positive cases. It's a high volume of quarantining of the staff, just like the hospital situation. If you don't have enough staff to have school, you just can't safely have kids in the building. I sent out a statement yesterday to our parents and our staff and our community to let them know that we are not to that point yet, but we are getting very close to reaching the capacity of our staff to safely open our buildings, have our classrooms. And I just wanted to give you some tangible facts on that. So about every 20 minutes, we are processing 7 to 10 reports of symptoms, people with symptoms, pending tests, or positive test results. And when I say processing, that is a long series of phone calls and questionnaires and reports to the Department of Health Services and the Texas Education Agency, which really involves us quarantining numerous people every hour on the hour, and then the ripple effect takes over. We're trying to cover classrooms. We're trying to make sure that we can still keep our classrooms and our students supervised and safe. You know, with our staff, we are struggling with substitutes. We have been averaging between 45 and 50% fill rate on our substitutes, which means that every day we need 40 to 50 subs. And we only get 20 to 25 people to cover those positions. So we're pulling lots of other staff to supervise our kids. And they're all willing, they're all ready to do whatever is asked, but that is pulling them and diverting them from their other jobs, which we want to make sure we don't compromise any safety in our procedures and just our protocols in our buildings. It's not just our teachers, our custodial staff. We are down 30% of our custodial staff is quarantined or sick. And all of our campuses are already on all hands on deck. We're emptying trash, we're cleaning and disinfecting our own classrooms. We're doing that, and everybody is very willing to do that. But again, that is diverting us away from the work of supervising kids and teaching kids and making sure we're doing what we're supposed to be doing. Our student services are also at the brink. We have no substitute bus drivers. And so we have several that are out sick. So we have created some redundant routes where we're pulling teachers from first period classes to drive buses. We're covering their classes. We're getting kids there, but they're not getting there on time, but we're getting them there. And so those internal student service systems are beginning to crumble because we don't have enough staff to do them. Our food services department, we're down several staff in that area. We're training our administrative staff to become food handlers, certified through the state, so we can serve meals because we're not able to have enough people legally able to serve meals to our kids. The good news is we have less than 5% of our students population quarantined. Around 200 students are quarantined. Not very many of those are positive, but they're quarantined because of positive exposures in their home or in their families. You know, we've always been worried about the staff situation. That's always been our concern. Just like Dr. Seek said, it's not about, do we have enough classrooms? Do we have enough buildings? Do we have enough laptops? It's not about that. It's about, do we have enough staff to safely keep operating our schools? You know, we've been doing pretty well at keeping people safe in our classrooms and our buildings. Most of the tracing conversations that we have from quarantining and exposures is happening in that everyday life. They're eating out with friends, they're gathering in homes, they're hanging out, large groups, like Dr. Seek said, where they're not wearing masks and they're not distancing. That's where our exposure issues are coming from. And we have some sick staff. We have some that are just quarantined from spouses, but we also have some that are taking care of their own children that are quarantined. So, and that pulls them out of the classrooms as well. So it just evolves very quickly how short we are on staff. We're not there yet. We're not to the point where we cannot keep our classrooms open, but we want to be honest with you and candid with you and let you know that if this trend doesn't change soon, we are going to have to make the difficult decision. And we know that when we do that, that impacts our community because our businesses, our parents can't go to work if they have to stay home with their children. We understand the impact that has on our community, and we desperately do not want to have to do that. But we also cannot be naive to the fact that if we don't have enough staff in our buildings, we can't safely have our children there. So every time I talk to people, they ask me, what can we do? Well, again, to echo what Dr. Seek said, keep the masks on. I understand it's not something we want to do. It's an inconvenience. Some people don't politically or even medically believe it. But if it helps keep our schools open, it helps keep our business open, it helps keep our hospital operating, that is something that I'm willing to do. Keep our distance, wash our hands, just those basic things is what we're asking people to do. Back in March, everybody rallied together in our community, and it was wonderful to see everybody make those selfless acts to keep each other safe and healthy. And then we kind of come out of the woods with this, and we thought, okay, we've made it through this. But we are just now in our situation in the Panhandle that so many of the other bigger cities across the country experienced back in March and April. And so when we talk about, rallying the troops, Pampa's been through a lot. Pampa's been through some horrible things, but our community has rallied together to do that. And that's what we need now, is to really do whatever it takes to keep our schools open, our businesses open, our hospital open. And so that's what we're pleading for, is that you just help us keep our staff going so we can keep school open.
Thank you, Dr. Larkin. Does anybody have any questions or anything else we need Dr. Larkin to address? All right, thank you, ma'am. Next, we're going to Gray County Judge Chris Porter.
Hi, everybody. The last time we spoke, we weren't sure what situation we'd be really facing in March of earlier this year. And I don't want to say we had it easier than what we anticipated, because we sure didn't, but it wasn't nearly as dire then as what it is now. And I think that you can hear echoed in the sentiments of Dr. Seek and Dr. Larkin that there are some very difficult decisions that a lot of our people are having to make every day, that in normal circumstances we wouldn't have to make. And part of what we need to do is make sure that we're supporting these decision makers in the fact that they are trying to make the best decision for the whole. And we also need to realize that we have some control over this. In our outlying cities, McLean and Lee Forest and Allen Reed, and in our county, McLean has been hit with a round of this earlier that thankfully did not escape a nursing home to infect the entire community. In this situation, we have rampant community spread at this time. I just received our dishes report, and you can see how thick that is. Those are all the recoveries and all the actives that we have in our county. At this time, we have 82 active cases that are actually verified cases. We are on a backlog from the Department of Health on notifications for up to 24 to 72 hours. Unfortunately, this morning they had 2 positive cases who reported to work and didn't realize that they were sick until they took their temperatures and ended up sending everyone to the house. So we're seeing this statewide and area-wide. Even New Mexico, Oklahoma, Colorado are getting hit pretty hard. I have had a lot of conversations with people who are adamant about the fact that asking people to wear a mask and sanitize their hands or wash their hands is some sort of population control or a nefarious plot to control the population. And I will tell you, I am as staunchly conservative as you can find. We're not asking people to make a decision on whether they're going to give up their guns or whether they have freedom of speech. We're asking people to protect the others around them by wearing a mask. And I don't understand the resistance to that. I've been in businesses inside Pampa that the owners of those businesses have told me while I was wearing a mask that I can take it off, that they don't support the mask order from the governor. And I agree that state bureaucrats are difficult to deal with at times and sometimes push down unnecessary orders, but this is not one that we need to ignore. As Dr. Seek said, we've got a significant amount of our hospital that is inundated right now. We have cases in the community, and every one of us has been affected by this. I have family members who are fighting it as we speak. And, you need to realize that until you have it or until you're affected by someone who has it, it sounds really good to tell everybody that you can't make me do something. But I know that there are people in the community who at this point in time have either had it or currently have it, who wish that they would have gone ahead and worn a mask. We're not asking for anything really unreasonable, in my opinion. I understand there are underlying medical conditions that may prevent people from doing that, but our community, we have to protect each other in our community. And so part of that is with this virus that is so very volatile. There is no rhyme or reason as to who it affects and how it affects. And one of the biggest tellers of that is the information we received yesterday from the prison. The TDCJ and I had multiple conversations yesterday, as did the Department of Health before we released the numbers. And while I was talking to the TDCJ, their executive director told me that of the 431 positive tests they had in testing every inmate they had last week, only 25 are symptomatic. I want you to think through what I just said. There's 25 inmates symptomatic, and there's 400 who are not, that are testing positive. So when we say that our numbers are 80 positive cases in the community, that number could be 1,000 positive cases in the community that we don't know, because people don't understand that they have it and are asymptomatic. So the numbers, you can't get away from those numbers. And so I would encourage everyone who's physically able to adhere to what the governor's asked, and to wear a mask when you're in public. We can't stop going to the grocery stores. I don't want to see our restaurants closed. There's been a lot of controversy over bars, and I understand it. I am saddened and heartbroken for some of the people who've had to make difficult decisions about their businesses. But to me, helping our community out by wearing a mask is not too big of an ask. So I would encourage everybody to do your part, not just for you, for everybody in our community. The other thing that everybody probably needs to realize is that we are seeing some people who have had it early who are also getting sick again. And this has been a discussion that is kind of quiet right now because there's not a lot of those cases, but it is possible. And so even though you've been sick with it or have recovered from it, that does not mean that you are immune from this forever. It's why they're trying to push the vaccines out. And until those vaccines come out, we're just going to have to really adjust to this different virus, this different animal that we're dealing with. There's nobody who wants to go back to normal worse than I do. My mornings are typically taken up with verifying cases and discussions with the Department of Health and with the members of this COVID team. And, this has been a tax on our entire county, just in the fact that our resources for a time were very, very thin. But I get a sense of normalcy in the community where people are going back to normal. And I understand it. I understand the frustration with doing what we're doing, but we're not out of this. And so I would appreciate if everybody in the community would do your part and wear a mask when you're out in public, and not congregate in large groups. Thanksgiving and Christmas are coming up, and I am torn over my own family members coming for Christmas and Thanksgiving, and these are horrible thoughts that you have about things that are regular in our lives, that are that sense of normalcy. I encourage everybody to be careful with large gatherings. We are basically a ticking time bomb for a week after a large gathering to see if anybody is positive and if it's spreading. So with that being said, I don't want to leave this with, just completely dire. We will get through this. Gray County will survive this. This is not the end of the world as we know it. We're just asking for a temporary change in our behaviors and our habits. And I would encourage everybody to support our medical community and our school community and our municipalities and our officers and our deputies and our firefighters out in there. And one of the hardest hit people that we've got in our county right now are our ambulance crews. They are working long, exhaustive hours, and we all need to support these people. They're doing us a phenomenal job, and I cannot applaud the school system and the hospital and the medical workers and everybody I've mentioned enough, because they've been working extra shifts. They've been doing things they've never been asked to do before, and they're accomplishing it. So, I would just caution everybody, and if wearing a mask makes a difference between, somebody dying and living, I would sure hope that we as a citizenry would choose to wear a mask.
Thank you, Judge. Dr. Seek mentioned a minute ago about the amount of deaths that they're seeing. And just to kind of, Judge Porter, can you briefly talk about, I think it's important that the community here, we've kind of been stuck at 9 deaths on our report for a while. Judge Porter and myself communicate daily as we're putting out these reports on positive cases. Can you just, maybe real quick, communicate to the community how that report comes to you? I know people feel like we're stuck at 9 and they're hearing all this stuff, and Dr. Seek says he's seeing more and more and more, and it's not for the scare tactics, but it's more for us, for our transparency. Can you really just real quick talk about maybe why we're stuck at 9, and if there is more than that, what do you expect, that type deal?
Absolutely. Typically, I get a report every Wednesday. It was delayed today till late in the afternoon. I've just now received it in the last 2 hours. The Department of Health is the one who tracks deaths, and those deaths have to be on the death certificate as a COVID death or as a COVID-related death. There are 2 blanks there that you can fill out on a death certificate for certain reasons why someone has passed. The Department of Health also has to verify those. And so that process is slow in getting those deaths onto our case count. I have talked to them at length about how we can streamline that process. And it's not just that process. I don't want to focus too much on the deaths. The deaths are horrible tragedies for the families and the people that are affected by it. But our entire process, the Department of Health has been at times very slow to react. And so we're trying to get them to realize that in order for us to do proper contact tracing and to make sure that we don't have a super spreader event or something of that nature, we have to have accurate and timely data. And the deaths are something that have kind of lagged behind more than everything else. I know that our deaths are going to come up. I've been anticipating our deaths to come up. I know of people personally who have passed away whose numbers have not been attributed to. And, it is difficult every day to see the information and the people who have it in our community. It is the names that are there it's difficult to see. And so the people who have passed away need to be properly recognized for what happened, and their family needs that for closure. And, I've already dealt with the people who've had the conspiracies about there's money involved with deaths, and they don't want to recognize COVID deaths because that will make them pay money. And to my knowledge, that is incorrect information. I understand that there is a death benefit for being COVID related, but if we have a death that's reported and in the county, it's going to be followed up and it's going to be verified by me. And so the deaths are slow, and my apologies for that, but that is part of this process. Gray County is 21,000 citizens and a state of 28 million. And our Department of Health is broken up into regions that are substantial and large. Our Department of Health has responsibility for the entire Texas Panhandle and for the counties between Lubbock and Amarillo. Amarillo has their own health department. We fortunately, Dr. Seek stepped up at the beginning of this and was our health authority. And I cannot thank him enough for doing that, because he had no idea what he was getting into. And, so we're fortunate in that, because we have a local person who can talk business with the Department of Health on a medical terminology where I would not be able to. So we're fortunate in that. But the death count is going to go up. And again, this all comes down to verification too. When I get these numbers and I get the names of these people, there have been instances, and quite a few instances, where we had people from other counties who had tested in Gray County, and they had just not checked the box for being in Pampa, Texas, or being from where they're from. And so they were automatically assumed to be in Pampa or Pampa residents. So it's a taxing thing to go through and verify every single one of these, but it's something I do every morning, and I take it very seriously. Our deaths are going to go up, and when I'm notified of them after I've verified them, I'll be sure to make those numbers available.
And
Thank you,
let me
Judge.
kind of step in there, Dustin, if you don't mind.
No, not at all.
When we're looking at death certifications, a patient passes away, first, obviously the state is notified. The state releases that information to the physician of care, whoever was in charge of care of that patient. It goes to basically a website, a state-run website. Physicians log on to, put in their credentials, go to their site, and then we fill out the death certificate. Okay. There is a lag between the reporting to the state placing it on that server to allow the physician to sign it. And then at that point, the physician has out till 10 days from the notification to sign that death certificate. So it can be delayed from the state side, the physician side, just all the way down the line. But until I sign that death certificate saying this is the reason they died, then that death certificate is not released. Then that death certificate is released to the funeral home, and then the process from there. So there's several delays in that. So it's not within 30 minutes, you're going to get notification to Judge Porter that a person has died of COVID, because it has to be verified through the physician of care what the actual cause of death has been. So, and then as far as some of the tracing, just to kind of go back to testing, what I'd like to reiterate also is if you are tested, you need to stay home until you get a result. You don't get to go out and be in public until you get your result. And everybody in your home needs to stay home. I know that's an inconvenience. I know it's a problem, but when someone is tested, they don't go out. Their close contacts, as far as home, should stay home until they get that report back. So there are delays in that reporting, but it's still kind of a personal responsibility of, stay home. and don't go out and spread that. I mean, I've had people show up in my office and go, "Oh yeah, I was tested for COVID a day ago." And I'm like, "Why are you here? Why didn't you report that to somebody?" Well, all you're doing is putting everybody you've come in contact with at risk, and at risk of shutting down other places of employment, shutting down other households, shutting down facilities. So just to put that out there too.
Thank you, guys. That's good information. Anybody have anything else for Judge Porter? All right, we'll move on to our Gray County and City of Pampa Emergency Management Coordinator Wes Schaefer.
The only one thing that I've really noticed that has really ramped up is early on in this incident, we've really had a lot of requests for PPE. Unfortunately, those requests have drastically changed. Now we're looking for nurses, doctors, respiratory therapists, even body bags. That gets real pretty quick.
Thank you, Wes. You guys have anything else for Wes?
No, Dustin.
All
Thanks.
right, thanks, Wes. All right, next, our city manager for the City of Pampa is Shane Stokes.
Thank you, Dustin. There's a couple of recurring themes here. One of them is the fact that everybody needs enough staff to operate effectively, and the city's no different. We're approaching close to 20% of our staff that is out quarantined with COVID or sick with COVID. To that end, we are going to be starting tomorrow. We will implement what we're calling a limited access plan, where city facilities are going to be closed to the public to help limit person-to-person contact. We feel like it's important for us to lead as the example and in trying to limit as much public interaction as we can. So city facilities are going to look a little bit different for the next period of time. I will stress that we're not reducing or eliminating any city services. Our hope is to keep the ability to maintain those services at the level that our citizens expect. So real quickly, I'll kind of read some of this, but City Hall will be closed to the public. It will be available by telephone or email or virtual meetings. If you have a need for business at City Hall, you can call the main number of 806-669-5750, and you'll be directed as to how we can take care of your business for you. That includes our utility billing, our water department, or we have our kiosk outside that you can utilize. We have telephone pay, we have internet pay. The same for municipal court, code enforcement. Everything within City Hall can be taken care of by the phone. If they have to arrange an in-person meeting, we can do curbside service. Our animal shelter is going to go back to curbside service as well. Our library will also be curbside service. Our parks are going to remain open. The Parks and Recreation Department will no longer be reserving parks. There'll be no events at our athletic facilities. Our Hidden Hills Golf Course is going to remain open. However, there will be no tournaments allowed. Our rental facilities, including MK Brown, the Chamber of Commerce, and the Armory, will not be booking events until further notice. You can contact Tracy Washington at 806-669-5790 to get more information on that. And then if you need any more information on any of this, please call City Hall 669-5750. Again, the other recurring theme is wear your masks. We're city employees, again, trying to be the example. We're going to be wearing masks anytime they're around the public or out in the public. We wear masks anytime we're indoors when we're not completely alone. Just trying to stunt this curve or slow this down. We don't want to overtax our hospital and our hospital employees, because that's when it will be dire. This is kind of painting a grim picture here, but it's because it is a grim situation. So that's really about all I had, Dustin. Thank you.
All right, anybody got anything else for Shane? All right, thank you, Shane. Now we're going to move on to City of Pampa Mayor Brad Pingle.
Thank you, Dustin. Definitely our city and our whole community is in trying times. This is something that I don't know that in our small community, when this pandemic started back in February, that we knew that it would finally hit our town at a load that it is and put a strain on our hospital. The governor's orders that we fall into, which falls into the trauma service area A, which means that the hospital rate overall, we're at over 31%. So that brings us into that trauma level or trauma service area A, which says that businesses should be operating at 50% capacity. Restaurants should be doing the same, but also we are still under the state mandate of wearing a mask. So what we as a COVID task force team have talked about, and we want to really encourage our community to help out and do our part. Our part being, if you are a business owner or a manager of a business, we ask that please post signs up that make or ask people to wear a mask before they enter in, to protect your staff, to protect the other customers that are in the building. I think at this point, as our community, we have to take control of this in some way. And we've definitely heard from Dr. Seek in talking about the alarming numbers, that how important it is for our community to have a hospital that can function and operate daily to not only the COVID patients, but other injuries or sicknesses or illness that may need to go out to the hospital. So, but it's going to begin with our population, where we have to take care of ourselves, we have to take care of one another. And I think really the whole theme of this is wear your mask and social distance and try to avoid the large gatherings as best you can. We have to flatten this curve at some point. So on behalf of our team here, who definitely cares and brings different insights to each entity, we ask that you please carry forward and do the best we can. We will get through this at some point. And we heard people say, you know, this too shall pass, and it will. But we've got to get through this bump in the road. So please, again, take responsibility for you, your family, and businesses. Please help us out, and please make people wear a mask before they enter into your business.
Thank you, Mayor. You guys have anything else for the mayor? Does anybody have anything they feel like they missed out and want to throw back out there before we close for the evening?
I'll say this one thing, and it's something that you know, none of us talked about, but I know all of us believe in, and that is, you know, praying does a lot for people. And I'd ask that you pray for all of our leaders and our people who are affected, and our community and our nation. Very turbulent times, but you know, the power of prayer is a strong thing, and I think I probably echo that from everybody who's here. Just keep praying for us, and keep praying for safety and for God to come in and resolve this situation.
All right. Thank you guys for giving us your ear tonight. I want to reiterate what several of them have said, that it's been a pleasure serving with this group on this COVID task force. I mean, I've sat in some meetings where I've seen, you know, almost some tearful decisions having to be made for our community. And it's tough. It's really tough. And trust me, everything is taken into consideration. And these guys have done an outstanding job of keeping the community informed and trying to stay out in front of this deal and protect you guys and protect our community and your family. So once again, thank you for listening tonight. We're sorry it's such gloom and doom, but like they said, we'll get through this, and we need your guys' help. So thanks for joining us, and take care of yourselves and your families.